Hello, we are the Association for Child and Adolescent Mental Health, or ACAM for short.
Diagnosis is really important, and what genetics has told us about that. I think we're all trained to, sort of recognize diagnosis, and from a research perspective, it all seems very tidy, but we know in real life practice it's not like that. And what genetics has shown are two things. Number one, the same genetic risk factors cross different diagnostic boundaries. And I think that's quite interesting because you quite often see in a child, they may have one or two different types of conditions and traits of lots of others as well. It isn't just a tidy, neat bag of one diagnosis. The second thing, which is again a really clinically important problem, and I see it particularly with ADHD and autism, but I guess you could see it as well in depression, is that what genetic studies have shown is that many of the conditions that we see and we think of as diagnoses, actually, the genetics shows that they exist along a continuum in the population. So there isn't suddenly like a clear-cut demarcation where this is a diagnosis that's completely different from the rest of the population. And, I know that lots of times in my clinic, you're really sort of thinking about quite carefully about these sort of sub-threshold cases. And, it isn't always so clear-cut. And I think the genetics shows that really clearly about how genetic risks operate across a continuum, and many of the sorts of diagnoses we see actually behave like a continuum in the population.